And no, we did not wear red to coordinate. This was just
This
serendipity.
is one of those days.
One of those
It's
days.
a special day for us.
All right.
Thank you.
Well, why do you wear red?
Well, because we're the senior center where I live, we wore red for the patriotic, remembering the soldiers, men and women in the service. That's what we do. Our tradition at the community center that I live at.
Well, very good. We wear red here at Sunrise Urology because we want to remember everyone deployed. RED, red.
We're on the same page.
Yes, sir.
There,
All right. So you happen to come back in the office for some other reason, but you wanted to share what you went through several years ago.
Right.
Before you came into the office, you were having some trouble urinating. Tell us what you had done before you came into the office.
I had, I'm not sure of the names, but like a Urolift, and I had different procedure done to aid in the steady stream and empty completely, which I was not. The procedures were not successful given a couple months. They came on, the advertisements were there, but the fact of the matter is I came right back to where I was before.
Okay, it sounds what you told me in the past was that you had a resume and you had a Eurolift done by two
Right.
separate urologists
Right.
before you came here.
That is absolutely correct.
And you said it worked or didn't work at all, or
They were, as I recall, they were to me because I guess they were mildly successful initially, and then within 2 or 3 months, 4 months, I was right back where I was beginning. So I was very unhappy with that.
yeah, that's unfortunate. And what we then you came into the office still frustrated with your urination. What exactly were you feeling at that time after you had the prior procedures?
Well, I was looking for relief, and the procedure as I call I think you
What
call
were
it.
you trying to get relief from?
Well, I was having trouble with the steady stream, especially with emptying. I had frequencies of bladder infection, and so that's the bladder infection is the reason why I came to you. I did not know about what you call the rotor-rooter, but that's what you did, and it's been some time now. It's been wonderful.
It's been several years. So before I did the Roto-Rooter, I did some evaluation to make sure you're a good candidate for the procedure. I looked in the bladder, I measured the size of your prostate, and then we proceeded with that surgery. And sounded like you had a pretty uneventful recovery. Am I correct?
That is absolutely correct. I had kind of with the bag hanging there for a couple of days, roughly a week. Came in and it was smooth sailing, really all the way through it. My expectations were met, meaning yeah, I had some discomfort, and obviously, and it was a little scary because I'd never been through something like that. But it worked out. I followed the lead of you in your office, and they said, "Do this, expect this." It was well prepared, and once my brain was able to cope with it, it went very well. And then especially after about 4 or 5 days, it was smooth sailing.
So it's been several years since you had the surgery. Tell us about the guys are always worried about, am I going to be leaking and peeing on my pants? And also, am I going to have any negative sexual side effects?
Well, the good news is I've had very, very isolated instances of leaking. It's just from time to time, especially in terms of sex. Within, for me, within the first 24 hours, I'll have a few drops, which means just that. I notice it in my underwear, and then it stops. And I was concerned with my Parkinson. I was concerned about that type of thing, and the complications from it. So the good news is it's not affected my. I'm happy to say at 80 has not affected my sexual life whatsoever. It's been wonderful, and being able to get up 2 or 3 times, or probably twice a night, which is normal because I have one kidney, and so I tend to drink a fair amount of water during the day. I keep hydrated. Everyone tells me do that, do that, so I do that. So that would partially explain why I think I'm comfortable with twice a night. Sometimes I get one. Wow.
So it sounds like what you're saying is you have minimal, if any, leakage on a
Right.
regular basis and no trouble with erections.
None whatsoever. I'm delighted to say.
And even at 80 years old.
I'm 80. In November, I'll be 81.
Even with 80, one kidney, Parkinson's disease, and you had a TURP Roto-Rooter several years ago, done by yours truly.
Not bad.
Not bad, I would say.
And we thank you, doctor.
Oh, you're welcome. Now, what will you tell guys who are a little hesitant and they have trouble urinating? What will you tell these guys now, having gone through what you went through?
Well, I got lucky, and I know this is going to, I hope this sounds right, but I would say come to this office and talk to you and give you full disclosure of what's going on so that you got a full deck to play with and you know what the history is and you can anticipate. Like you asked me all about my background and that kind of stuff and the Parkinson, you're very thorough. So come here, talk to them, lay it out. I am very satisfied.
Well, that's great. You're welcome. That's great to hear. You don't necessarily have to come here, but at least seek
Well,
help.
that I'm out of courtesy. I want to say, talk to your physician. Hopefully it's Dr. Lynn.
Well, I
Enough
appreciate
said.
that, but I just want to encourage guys to get help because this is
Yeah.
something that you can treat and cure.
Absolutely. And I'm a living example. I'm a walking ad for the procedure. I tell the guys where people were, because I move around a lot of different functions, know a lot of people. And usually sometime, and it's frequent, this topic comes up with guys, you know, you're talking about you too, huh? Or they're wearing a pad or whatever. And so I tell them, talk to the urologist, make sure they know what you're doing.
Yeah, I think that's great advice. Well, thank you so much, Miles, for sharing your story.
Glad to do it. Glad to be part. Thank you.